Good morning, guys. Well, it's peeing down with rain, it's windy, it's cold. Is that enough to dampen my spirits? No, of course not. Yesterday was World Mental Health Day. Wasn't it wonderful? Seeing all the social media, people changing their Facebook profiles. Lovely, lovely, lovely. Yeah, isn't it weird? Today is World Mental Health Day. Tomorrow will be World Mental Health Day. We live in a very superficial society. So, whilst yesterday was over, and it was officially World Mental Health Day, let's bring today to be World Mental Health Day and every day. So what does it really mean? What has World Mental Health Day achieved? The answer is I don't know. Will changing Facebook profiles, will telling people to talk more actually bring about an improvement in mental health? Will it achieve what it was set out to? I think that the goal is just too far away. So I don't think somebody with mental health problems yesterday will say, perhaps I will seek help. You know, today's Mental Health Day. Hey, I'll go seek help. I think that destination is too far away. So I think we need to have a little rethink about what we're trying to achieve and how we're trying to achieve it. Yesterday was fun. I love my job. I hope you can tell. I'm passionate. A bit ranty. I'm a bit ranty for a very good reason, and we'll go into why I'm so ranty and put it into some context. One of my guys, over 40, it was finger up bum time. So every year he has a finger up the bum to check his prostate. And we always have a giggle. He is an alpha male. And when I say alpha, he's proper alpha. But he's cool, very cool. So he said, never did I think when I was younger that I'd be paying somebody to stick his finger up my bum. But it's always a matter of perspective. So the reason why we stick fingers up bums in clinic is obviously to check the prostate, to make sure I can't feel anything sinister, and also to have a feel to see if it's enlarged comparable to the last time, and then to see if that associates with any lower urinary tract symptoms, because then we can obviously act accordingly. So obviously a bit of a giggle, but there obviously is a very serious point to why we do a physical examination, which includes a digital rectal examination every year on our guys over 40. We have actually picked up cancer on pre-screening, so please make sure you do get yourselves checked. Okay, there is an increasing instance of prostate cancer in this society, and I'm pretty damn convinced it's because testosterones are dropping, which they should do. And what should also happen is your estrogen should drop, but it's not. Okay, we live in a society with a propensity to aromatization, and estrogens are rising. Now, there is evidence to suggest that actually the causative agent for prostate cancer is estrogen. So we're always trying to balance that testosterone and estrogen ratio. My other guy, I think he's late 30s, and He came to see me, I think it was last year. We commenced him on TRT. He noted an improvement in his mental well-being, and his numbers are absolutely cracking. You couldn't want for better numbers. They are within the normal physiological range for every single parameter. And he did notice an improvement in his mental well-being. Unfortunately, life has knocked him on his arse, and that comes from his past and his present and concerns regarding his future. So he's now under a psychiatrist, and hopefully this will bring about a positive change in his mental well-being. They want to place him on some antidepressants. He hasn't reacted very well to antidepressants in the past, and even sort of mild doses have caused negative side effects. So I'm not 100% sure whether antidepressants are the best route for this guy, but I'm not a psychiatrist, so it's not my place to interfere with that aspect of his care. What I am very annoyed about is the psychiatrist wants him to stop testosterone replacement therapy because of the misinformation and misconceptions out there about obviously heart attacks and strokes, and it's all about muscles and being an alpha male. So you ask me why I rant about the guys that are promoting super physiological levels and just increase the dose until you feel amazing when they start off at 200 milligrams a week. What we are trying to achieve here at the Men's Health Clinic is not only build a successful clinic and a successful business, because you do have to play the game. You know, I obviously do need to earn a living, so it is a private practice and it's a fee-paying practice. We are trying to improve access to the average schmo, because there are guys out there suffering, and there are guys out there not receiving the care that they need because of the misconceptions and the misinformation that is abound in the internet. So my rants, whilst they may appear like I'm I don't know, whatever, there's actually a real reason for them, because it's a level of frustration, because it doesn't take a rocket scientist to work out that we are biological organisms. We should be working with our genetics, our physiology, and we should be trying to achieve normalization, because normalization is actually brilliant. So, hormones. So we want to achieve balance. Balance my hormones. I'm pretty damn sure that not only does low testosterone cause mental health issues, but there is a silent epidemic of guys with elevated estrogen levels comparable to their testosterone level. And this is an issue that is not being recognised or appreciated within our society. Now, the NHS doesn't even test for estrogen. Now, estrogen, obviously, testosterone gets aromatized to estrogen. Estrogen is the hormone that feeds back to the hypothalamus and tells the hypothalamus and pituitary to not produce more luteinizing hormone and follicle stimulating hormone. So it's a negative feedback loop. Too much says don't produce any, too little says produce some. So you have this issue not only from the hormonal balance, you are unfortunately, with a propensity to increase aromatization, only worsening your testosterone levels because you're inhibiting the feedback mechanism, or the delivery of LH and FSH to the testicles. I'm sure there is an issue with anxiety that is being put down to just being you, just being a psychosocial problem that you should just man up and crack on. Why do I think this? Because obviously we have patients who have an increased propensity to aromatization, and with that increased propensity to aromatization causing excess estrogen, they have an element of anxiety. That element of anxiety can be minor, it can be significant. One of our guys had the audacity to give us a 4 out of 5 star rating. I spoke to him a few months later, and he said he apologized for his behavior a few months prior. So you guys with high estrogen could be whiny little, and when we actually get you dialed in, you become far more calm, far more confident and secure in not only your inner self, but how you would project to the community. And so I said, listen, you better change that bloody rating. We want a 5 out of 5. And so obviously we had a giggle, and I think he changed his rating. So yeah, we bullied him into, no, I'm joking. So going back to this guy who's been advised to stop testosterone replacement therapy because they believe that normal levels is having a deleterious effect on his mental well-being. Now there's an absurdity to that. I'll put links to the stuff I've done before because I'm not going to go over it ad nauseum because it's boring. But what we're doing with him is we are doing some goal setting. Small, achievable goals. It's important to have a period of self-reflection, but it's also important to realise that possible increase in self-reflection may not actually serve you well if you don't have the right mindset. So we always talk. So he likes dogs. Now I recommended that he go to a dog pound and volunteer there. Now that was too big a step. He didn't do it. I kind of knew he wouldn't do it. So he's really struggling right now. So what I've said is small goals. You know, get up, brush your teeth, have your breakfast, tick, tick. Small little dopamine rewards that you can achieve without any need for any anxiety. Now, one thing that makes him anxious is obviously social situations. So what's a non-threatening social situation? Well, probably being in a park. Now, getting back to nature. We always talk about the importance of nature. So I said, every day I want you to walk around the park. Now, he loves dogs. So Ricky Gervais is another guy who's obsessed by dogs, much like me. And he said that he goes to the park simply to meet dogs. Now, dogs are pure. Dogs love unconditionally. They live in the moment. And I think that's something that we can learn from dogs. So I've told him to go for a walk around the park and say hello to dogs. Once he's comfortable doing that, then we can revisit the idea of working in a dog pound. Now, what's the difference? Because the outcome is playing with the dog, which is going to give him some satisfaction. Well, the difference is giving back. Okay, so these dogs in the dog pound are in need. So they're in need of our support. And I think this is the message. So we live in a very narcissistic, materialistic world. And we shouldn't give in to the temptation. The business model is all about sell, 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 and take. And that's very, very wrong. So why a dog pound? Because those dogs do need your help. So if you can give something back, now a dog isn't going to judge you. A dog is quite possibly the most amazing animal on this planet. So if you can give back to something that is pure, and you will receive a reward, you will receive a dopamine reward from doing something that is altruistic. Volunteering. Now, money is important, we've got to play the game, but if you do something without expectation of a monetary reward, we're always climbing over each other. We shouldn't be climbing over each other. We should be trying to give something back to society. Now, hopefully, once he's done that, he will start communicating a little bit more with people, and then we can start building some more goals, some more realistic goals in the future. See, I'm not a psychiatrist. I mean, you know, this is only my perception of how we should act as human beings. You may disagree. I don't care if you disagree. But this is how I want to approach life. So the message is every day is World Mental Health Day. The message is give something back. It doesn't have to be big. It can be very small. It can be letting somebody out from a junction. Something very similar. People are so great. I mean, it's so kind of queer. People are so grateful when you actually when you let somebody out from a junction, and then you can see it has the butterfly effect. Later down the road, you see that person that you let somebody else out. So I think to effect a positive change to society, it needs to start with you. And it you know, these kind of campaigns regarding let's change our freaking Facebook profiles and talk about mental health. You know, I don't think that's going to reach somebody who is actually struggling. It's all about being a little bit kinder to your fellow human being, and realizing that if you want to put it into a biochemical argument, is that dopamine reward that you will receive from being kind is far greater from the perverse dopamine reward that you believe that you want or warrant from taking. So that's my little philosophy on life. Social media, it can be used for good, but unfortunately it paints a very perverse, unrealistic picture of reality. And I think we need a bit of realism in our lives. Hormones, yeah, high estrogen, it's a problem. I'm 100% convinced it's a problem. Low testosterone, it's a problem. High testosterone, it's a problem. We need to establish hormonal balance, and with hormonal balance you have the foundations to make good choices, not bad choices, good choices. And if we can start this butterfly effect, it's the chaos theory, isn't it? Then I think we can actually affect a positive change to society. That is reality. That is what we should be doing.